Hola, muy buenos días, buenas
Good
tardes.
morning, good afternoon from PAHO's headquarters, the Pan American Health Organization here in Washington, and welcome to this press briefing on COVID-19 in the Americas. My name is Luciana Viegas, PAHO's advisor on public communications, and I am here with you on this Wednesday, November 17th. As every Wednesday, we do have interpretation into English, Spanish, and Portuguese, as well as French. We have already received your questions via email, and you will be able to ask your questions by using the Q&A button. Today, PAHO's director, Dr. Carissa Etienne, will be reporting on the COVID-19 situation in the Americas, and she will also be referring to the increase in the undue use of antimicrobials to treat patients with COVID-19 as part of within the framework of the International Week on the awareness on this topic that starts tomorrow. We have today in this session, Dr. Jarbas Barbosas, PAHO's Assistant Director, Dr. Ciro Ugarte, Health Emergencies Director, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19. So we open now with the remarks by Dr. Carissa Etienne so that she can share the regional update.
Thank you, and good morning. Thank you for joining today's press briefing. Last week, there were nearly 760,000 new cases and 12,800 COVID-related deaths, and those were reported in the Americas. We have seen a 5% decrease in new cases in the region of the Americas over the previous week, and a 17% decrease in new deaths. Some of the most populous countries in the region, like the United States, Brazil, and Colombia, are seeing a leveling of new infections after weeks of declining trends. In North America, Canada, cases and hospitalizations continue to drop. In the Caribbean, the Dominican Republic and Barbados continue to report a steady rise in new infections. The Cayman Islands is experiencing its highest incidence of COVID infections to date, and 2/3 of these cases are among the unvaccinated. Meanwhile, Trinidad and Tobago is witnessing a sharp rise in COVID deaths as ICU beds fill with COVID patients. But countries across Central and South America are seeing a decline in new infections, except for Bolivia, which continues to experience rising cases. As Uruguay and Chile have relaxed public health measures, they're also witnessing a spike in COVID cases, even despite their high vaccination coverage. It bears repeating that the COVID pandemic is still very active in our region. As we near the holiday season, we remind everyone that it's up to all of us to keep each other safe by getting vaccinated and following the public health measures that have proven effective against this virus, like social distancing and mask wearing. Today, we have reached an important milestone. Half of people in Latin America and the Caribbean have been fully vaccinated against COVID-19. And nearly 3.5 million COVID vaccine doses are due to arrive in our region this week, helping us reach even more people. But many countries remain far behind. Less than 20% of people have been fully vaccinated in Guatemala, Jamaica, and St. Vincent and the Grenadines. And vaccination coverage remains in the single digits in Nicaragua and Haiti. As we continue to push to get the region immunized, today, I wish to call your attention to a very important consequence of the COVID-19 pandemic, antimicrobial resistance, or as it is referred to, AMR. Throughout this pandemic, we have seen the use of antimicrobials rise at unprecedented levels with potentially serious consequences for years to come. Data from hospital settings in the region shows that 90 to 100% of hospitalized patients were given an antimicrobial as part of their COVID treatment, while only 7% of these patients had a secondary infection that required the use of these drugs. Antimicrobials are crucial, life-saving drugs, but they must be used responsibly since bacteria can develop resistance and render these drugs ineffective over time. In fact, that's exactly what we are seeing, thanks to the overuse and misuse of antibiotics and other antimicrobials. We risk losing the drugs that we rely on to treat common infections. Our recent epidemiological alert noted the emergence of bacteria that are resistant to last resource antimicrobials with a magnitude and complexity that were not previously described. Across our region, several countries, including Argentina, Uruguay, Ecuador, Guatemala, and Paraguay, are reporting surges in detection of drug-resistant infections that have likely contributed to the rise in mortality that we have seen during the pandemic in hospitalized patients. Let's not forget that health facilities have been overwhelmed by the COVID-19 pandemic. Many ICUs operated at 2 to 3 times their capacity. A rise in the use of invasive procedures such as intubation or ventilation, the use of antimicrobials and other drugs, overcrowding and underlying conditions such as diabetes or obesity increase the risk for patients for bacterial and fungal infections. Limited availability of gloves and gowns and changes in cleaning and disinfection practices were other factors that led to infections spreading more quickly. Antimicrobials have also been misused outside of hospital settings. Drugs such as ivermectin, azithromycin, and chloroquine were broadly used as unproven treatments, even after we had strong evidence that they had no benefit to COVID patients. Health professionals everywhere should practice responsible use of antimicrobials and to prescribe antibiotics only when needed, because misusing these drugs is harmful to patients and also to public health. And countries should ensure that people cannot buy antimicrobials over the counter without a doctor's prescription. To help preserve the power of antimicrobials, we need better surveillance, better stewardship, and better drugs. For over 25 years, PAHO has been helping countries track the spread of antimicrobial resistance and raise awareness of this serious challenge. We have been pleased to see many countries maintain and expand their surveillance systems during the pandemic, and we want to encourage them to leverage those laboratory networks to track antimicrobial resistance for the foreseeable future. Antimicrobials are still being misused to treat COVID infections, so countries must promote clear, evidence-based treatment guidelines so clinicians know when these drugs are recommended. It is only through better stewardship and infection prevention and control that we can prevent the spread of resistance. And finally, we need to invest in new and better antimicrobial drugs. Today's pipeline of new antimicrobials is very sparse. Yet, we rely on these drugs to treat a whole host of infections. Just as we were able to channel our collective capacity to develop diagnostics and vaccines for COVID in record time, we need commitment and collaboration to develop new and affordable antimicrobials. Any new drugs must be accessible to countries, regardless of income. And that's a core focus of PAHO Strategic Fund, which helps countries keep the cost of drugs, medicines, and products under control and ensure adequate supply. So these tools are available when patients need them most. Throughout this pandemic, we have taken the power of antimicrobials for granted. And while it may be months or even years until we see the full impact of their misuse and overuse, we cannot afford to wait to take action. Let's start today on the eve of World Antimicrobial Awareness Week, which is more relevant than ever in the context of the COVID-19 pandemic. We need all countries to work together now to control the rise in antimicrobial resistance so we can continue to rely on these drugs to treat diseases and to prevent an unprecedented crisis. Thank you very much for listening.
Thank you very much, Dr. Tien. An important call for countries to control antimicrobial resistance. Follow-up questions on this. We start with that. How can countries do this? And what steps do countries need to take? Dr. Tien.
So let me thank you for this very important question. Antimicrobial resistance, or AMR, was and still is a major global emergency, causing some 700,000 deaths a year. We already face a severe COVID-19 pandemic, and the parallel pandemic, it may be silent, but it's a parallel pandemic of antimicrobial resistance is gaining ground. We have seen an increase in the use of antibiotics to treat COVID patients and concerns about bacterial infections and overwhelmed health systems where infection prevention and control practices may be disrupted. Important public health actions we should take include prioritizing the AMR response, preventing AMR emergence and spread, monitoring the impact of the COVID-19 pandemic, and continue investing in preserving and developing antimicrobials and AMR response. Countries should also adopt regulatory measures to stop people from buying antibiotics without a doctor's prescription on the internet, etc. The veterinary sector has a huge role to play. We must limit the use and misuse of antibiotics in livestock and aquaculture for growth promotion because it has contributed to accelerating the emergence and spread of foodborne antibiotic-resistant pathogens, with implications for animal health, food security, and food safety, but also for human health. We advocate a One Health, multidisciplinary and multi-sectoral approach to address zoonotic diseases, AMR, food safety, and other health threats at the human-animal environment interface. Health ministers from the Americas have approved this PAHO One Health policy to foster coordination among human, animal, plant, and environmental health programs. All countries have national action plans and have advanced on this, but much remains to be done. We must prevent and prepare for current and future health challenges at the human-animal environmental interface. Our concerns for One Health are these risks that affect the system on which society depends: health, agriculture, and animal production, and the environment. really, I can't emphasize enough that all of us must do our part to combat AMR, from the regulatory agencies to healthcare providers, farmers, food producers, veterinarians, researchers for new antibiotics and diagnostics, to the very public, raising awareness of this major threat to public health. So thanks for that question again.
Thank you very much, Dr. Tien. Muchas gracias. Pasamos entonces
Thank you very much. Now we move on to direct questions on the situation of the COVID-19 pandemic. We start with a question by Melina Ochoa with UNO TV in Mexico City. Melina is saying that Mexico is leaving behind the peak of transmission of the Delta variant, and with the arrival of the winter season, there could be other subtypes of the same variant. She's also quoting Dr. Alejandro Macias, who said that the future variants will also be related to Delta and that the vaccines should focus on this new profile. The question is this the epidemiological situation in Mexico? What is PAHO's opinion? Should we focus the vaccines on Delta and its subtypes? Dr. Aldigueri. Thank you for that question from Mexico, but let me offer you a regional global focus in my answer. So far, more than 30 different sublineages have been identified for the Delta variant that are differentiated due to some general mutations as part of a continuous evolution process. Those sublineages are distributed in a heterogeneous way globally, and it was possible to determine in the Americas that there are at least 7 or 8 sublineages that are currently circulating together with the original Delta variant. So far, and based on the information regularly reviewed by the advisory group on viral transmission, including members of the Pan American Health Organization, there is no evidence that would allow us to determine the virulence pattern for those sublineages, which could be deeply different from the original Delta variant. There has been no proven Delta sublineage or any other sublineage of any other variant of concern that would be beyond the vaccines that are currently authorized by WHO. Since the Delta variant is predominant globally and regionally and almost the only one in circulation, it is to be expected that the sublineages that are generated are responsible for the outbreaks and the cases that we continue to see in the countries, and that could also limit, that could also be limited by maintaining the public health measures that have to do with social distancing and mask wearing introduced within the context of the pandemic in the region. All of the information that is created thanks to the global and regional genomic surveillance network is channeled to improve the formulation of the vaccines and to change it. I should also highlight that it is important to notice that there is just one SARS-CoV-2 virus and that the vaccines should be directed to protecting against any variant that could be circulating, including the potential sublineages that are generated as part of a biological process that is to be expected. And I hope I have addressed the question by Mexico. Thank you. Thank you, Dr. Aldigueri. Now we are going to ask about vaccination in the region. We have 3 questions. I am going to read the ones by Laura Barros. That is a combination with the other questions. And the director has referred to the milestone reached by the Caribbean and the region and the number of vaccinated individuals. Could we please be more specific as to the number of doses that have been given in the region? And another question that is also repeated, and this is by Hamilton and Turks and Caicos. Given the current pace of vaccination, when could we reach the 70% goal for vaccinated individuals? Dr. Barbosa, could you please refer to the goals and the current situation, please? Thank you. Thank you for those questions. First, as our director has mentioned, vaccination in Latin America and the Caribbean is moving forward. This is good news because we already have about 750 million doses that were administered in Latin America and the Caribbean. This is, in average, half of the Latin American and Caribbean population that has been vaccinated or that has received both doses, or one in the case of the Janssen vaccination that offers full protection. But we know that there is important or significant inequities among the countries. We have about 20 countries in the Americas that already have more than 40% of their population completely protected, but we still have 5 countries that have not reached 20% that account for the most vulnerable groups: health workers, the elderly, and individuals with underlying or chronic diseases. So we still see great inequality, and we need to continue to expand access of all of the countries to vaccines. There is no possibility for a country to be fully protected if other countries still have uncontrolled transmission, because that could be the emergence of a new variant that may not be protected by the current vaccines. Now, as to the 70%, WHO has established a goal to have by end of the year the countries with at least 40%. And when we look at the data from Latin America and the Caribbean, given the initiatives implemented by WHO, the idea is to expand access through COVAX and also the possibility to have direct acquisition through the revolving fund and also potential new donations. We think that almost all of the countries will be able to attain that goal. The 70% goal that was established by the end of the first semester of the upcoming year would imply greater access to vaccines. But let me share with you that in the past we used to say, and right now we used to think, that if we reach 70% coverage with the vaccine, transmission will stop. That is not true. That is a model that at the outset, when we started using the vaccines, was presented. But so far, we already have 4 countries in the Americas that have already surpassed the 70% rate of vaccination, and transmission continues in those countries. It is quite low. It is quite controlled when compared to other countries. But what I would like to indicate is that it is very important to use vaccination as much as possible to attain not only 70, but also 80, 85% or 90% of protection for everyone. But it is also very important to maintain the public health measures until transmission has been controlled. So vaccine coverage is not the only indicator to say that transmission has come to an end. We also need to monitor all of the epidemiological data. We also need to maintain public health measures, wear masks, for example, which are quite effective to prevent transmission. Thank you. Thank you, Dr. Barbosa, for your clarification on the goals. Let us now move on to a question in English on the situation regarding children.
Hamilton from Magnetic Media in Turks and Caicos. What are COVID infection numbers and deaths among children in the Caribbean region? A general question. Dr. Aldigueri?
Yes, thank you for this question from the Turks and Caicos. And so the trends in case incident in children less than 14 years in the Caribbean tend to follow the trends in adult cases. But overall, transmission level of cases and death among children less than 5-year-old and children between 5 and 14-year-old remain at the lowest rates compared to other age groups. In addition, cases in children may be slightly higher in 2021 because of the following reasons. Testing capacities were more readily available to the population. If we expand to the Northern Hemisphere and some movement of population during 2021, in the Northern Hemisphere during most of 2020, in early 2021, children were homeschooling. Also expanding to the Northern Hemisphere, summer camps opened in June and people went on holidays during July and August, which coincided with a general increase in cases. Also, very important, more adults have been vaccinated than children. And also starting of in-person school from August, September 2021. However, we have to take note that completeness of data in the line list per country that are shared with PAHO remains a challenge. And we are talking about different surveillance and reporting systems within the countries in the English, Dutch, French, and Spanish-speaking Caribbean. So the numbers need to be taken with some perspective. I hope I have answered the concerns of the journalists in the Turks and Caicos. Thank you.
Thank you. Muchas gracias, Dr. Aldigueri. Seguimos con la pregunta
Thank you very much, Dr. Aldigueri. We continue with questions about children and return to school. We have a question by Ileana Cornejo from El Mundo in El Salvador. Should vaccination be mandatory against COVID-19 for children to go back to the school in 2022? Dr. Ugarte may answer this question.
Thank you, Luciana, and thank you, Eliana, also for the question, which can be applied to many countries. Indeed, PAHO considers that that vaccination against COVID-19 is not mandatory for children to go back to in-person classes. However, we do recommend that vaccination of teachers and support personnel in schools and other educational institutions be implemented largely in order to be able to protect adults and children as well, of course. These recommendations are aligned with the roadmap recommended by the strategic group of advisors in immunization from WHO. And there are several measures that have proven to be effective to control transmission, including the permanent use of masks by students, by teachers and staff, reorganization of spaces, appropriate ventilation of school buildings, activities that are reprogrammed to avoid crowding children and adults in spaces, and also keeping the measures during transportation time to and from schools. Given that the risk of infection is maintained in the communities where there is community transmission and it can appear in schools, it is very important to implement follow-up measures as well as epidemiological follow-up measures, which actively looks for signs and symptoms among the students, among the staff and teachers, so that rapid infection control measures can be implemented, including suspending classes in certain areas and the communication with the people involved and their families so that they can take necessary measures in their homes. We should emphasize that when we speak about vaccination, PAHO has recommended on many occasions, as well as the WHO, to prioritize vaccination for those who are at the highest risk of infection and those who are at the highest risk of having serious conditions that may send those people to the ICU or lead to death, and extending vaccination progressively to other populations whose risk is relatively lower, considering coverage in the a higher risk population and the availability of vaccines. And therefore, it is important to also emphasize that each country adopts their own measures and makes the decisions according to their own environment, according to the conditions, the availability of vaccines and other additional risks. And therefore, while WHO to this point recommends only vaccination in the case of one single vaccine for those over 12 years of age, it still need to have more information about safety and protection for minors. And all these situations need to be analyzed specifically in each country and corresponding measures and decisions made. We have the responsibility of protecting children and older adults who are at a higher risk. Ileana has a second question about PAHO's opinion regarding the use of Sinopharm in minors. Dr. Ugarte mentioned something about this, but maybe Dr. Barbosa could add something else in this regard. Yes, thank you very much. This is a decision by each country, each regulatory authority, because each manufacturer presents all the documents whenever they have all the studies that are necessary, the trials, etc., to ensure that the vaccine is safe and effective. And all this paperwork goes to the national regulatory authority, and it is a decision made by each country. So we cannot say anything about that. Regarding PAHO, to this point, we do not have any manufacturer that has achieved all the information to receive approval from emergency use licensing for children. Manufacturers prefer many times to send the information to countries who want to buy vaccines for children. WHO has already received a request from Sinopharm and Sinovac for vaccination for children, and these requests are being analyzed at WHO, and we think within 2 weeks we will have a decision regarding the recommendation for use in children. But as I said at the beginning, it is a decision of each country, each regulatory authority needs to review the evidence and documents presented by the different manufacturers and make decisions based on that analysis. Thank you very much. Thank you, Dr. Barbosa. We have Dr. Altigueri, a follow-up question regarding detection of variants in Nicaragua. The question is by Lidia Lopez from La Prensa in Nicaragua. Lydia asks, how long is variant detection taking in Nicaragua? Has PAHO sent materials to help in this? And do we have any update in this regard, Dr. Aldigueri? Yes, thank you very much. And thank you for this follow-up question. We have an update. We have received information requested from the Health Ministry of Nicaragua with identification of the 4 variants in Nicaragua, of the 4 variants of concern, that is, and Nicaragua is responding to our questions. And I would like to put this within a context of Central America. It is a complete a situation which is consistent with the circulation of those variants in the rest of the countries in Central America. Thank you very much. Thank you, Dr. Aldigueri. Now we have a question about diagnostic tests from Adriana Suquet from Evecto Cocuyo in Venezuela. I'd like to know whether PAHO knows how many diagnostic tests of the PCR kind and antigen tests are being done in Venezuela on a daily basis. Dr. Ugarte, do you have an update? Yes, thank you very much for your question. The information that we have about how many tests are being done in the country. This is information that is updated in Venezuela. And the information we have to this point is that up to July, up to the end of July, the average of antigen tests was 510 per day. And according to other sources, which are not official sources, there's an indication that over 3 million PCR tests have been done and antigen tests for an approximate total of 5,000, over 5,000 tests daily. I repeat, this is non-official information. It has to be yet ratified by the government. And in the work done by our office with the Health Ministry and other agencies in Venezuela, we will eventually be able to report on a more accurate number or an updated number of the number of tests done daily. Thank you, Dr. Ugarte. There is a question from Melissa Gogino from Portugal. In English, she says,
cases in some countries around the world. I ask PAHO what you think about the inoculation of a third booster dose, and if this COVID booster will have to be from the same as the previous doses or from the same producing laboratory, and why. Dr. Barbosa, for you, perhaps the question?
Yes, thank you for the question. I think that we have two different questions. One is about boosters. Let me first remind that the third doses are not the same as boosters. The Strategic Advisory Group of experts on immunization, that is an independent body of experts that make the recommendations for WHO and PAHO, has already made two recommendations about the third doses. The recommendation is that, one, every immunocompromised person needs to receive a third doses in order to increase their response to the antibodies production to protect them against the COVID. So every people that has HIV, for instance, or that received an organ transplantation or are taking any medicines that can reduce the ability of the immune system needs to have a third dose. In the case of Janssen, a second dose. The people that received two vaccines that have a specific technological platform, the vaccine from Sinovac and Sinopharm, needs to receive a third dose if they are 60 years or older, in order also to reinforce the protection that the vaccine has provided to them. So these are the recommendations, and this is important to get these people, the elderly and immunocompromised, well protected. The SAGE is always reviewing the evidence, and maybe we will have in the next meeting in December new recommendation, but these are the current recommendations. The new wave that we are seeing now in Europe, I think that it has two different components. One is the countries like Russia and other countries that have a very low coverage, around 30, 35 or 40%, that are experiencing a very important increase in the number of cases and deaths, probably related with the spread of the Delta variant. And we have also other countries like Germany, the Netherlands, that have experienced an increase in the number of cases, probably because they achieved 60, 65% of coverage, but due to the vaccine hesitation, anti-vax campaigns, people that are denying the pandemic and the vaccines, they are not increasing the number of people protected. So I think that the real discussion now is not to discuss about the boosters in these countries, it's how the Ministry of Health can provide all the information that is needed, what measures they can adopt in order to reach a higher immunization coverage. Because it is clear that if you have only 60% of your population covered, you will still have 40% that's not protected. And this can be the source of a new wave in a country. What we are seeing in most developed countries now, is a new wave among the unprotected, among the people that are not vaccinated or had an incomplete vaccination scheme, one dose only, for example. So it's very important to get everybody fully protected. Thank you.
Thank you, Dr. Barbosa. Pasamos a la próxima pregunta de Matthias Löwy.
Thank you. We have a question from Matthias Löwy from Medscape Argentina. And Matthias says, many experts in Latin America have pointed out that we are in a transition phase from pandemic to endemic. Is this view correct? What are the criteria to characterize either something as a pandemic or an endemic? And could you relax the public health measures if we are already in an endemic phase? Dr. Aldeguerri, could you please give your comments on this regard? Thank you. Yes, I don't think that we cannot define well-delimited phases or stages in the evolution of a pandemic. The main characteristic of this pandemic continues to be uncertainty. It is possible that eventually the virus will, quote unquote, become endemic. Maybe this will take several years. In the meantime, we need to, or we will be seeing broad outbreaks, even in those places that have achieved a high vaccination coverage. In fact, this is what is happening in several countries in Western Europe, and this should be a warning. We have seen important increases despite coverages above 70%, vaccination coverage, that is, and where measures of social distancing and public health measures were not expected to have to be kept. As we have explained here several times in these press briefings, the main function of vaccination is to reduce serious disease and deaths. And this is what is happening, not transmission, not transmission. There is not an established definition of what endemic COVID-19 would mean. Endemic means the continuous presence of a disease in a population or in an area with a perhaps constant load over time or burden over time. And other respiratory viruses, which are significant, like, for example, the flu virus, occur with epidemics, and they are highly seasonal and a pattern which is harder to detect and predict in intertropical areas. So we think that public health measures and social distancing measures continue to be a significant key element that should be used based on the epidemiological evolution, which, by the way, as I said before, continues to be quite uncertain. This is true for all countries, and even more so for those countries and areas where vaccination coverage is low or heterogeneous, and where thus there is a high risk of high rate of severe disease and mortality. I hope I have answered the questions from Medscape Argentina. Thank you. Thank you, Dr. Aldeguerri. Now we have 3 questions from the Caribbean in English.
Kadim Joseph, and I'll just combine them all. Kadim Joseph from Antigua and Barbuda of Observer Media, but a similar question from Magnetic Media from Turks and Caicos, and from Kevin Felmin from Guardian Media in Trinidad and Tobago. General question on the Caribbean. Many countries in the region are experiencing a decline in cases, but a slowing of inoculations. Do we have anything to comment? What do we see for those countries? What is the main concern of PAHO for the small islands at this time, especially as we begin to look towards the new year? Some projections. Perhaps Dr. Etienne, you can take this question.
So thank you for this question. Of course, We are very concerned about the continuing rise in cases and deaths in some countries of the Caribbean. And this is especially so with the holidays coming up and increased travel to and from some of our islands. The best response is to continue our national campaigns to vaccinate all residents against COVID-19 and sustained caution by heeding the recommended public health and social distancing measures in all our countries, even those where the cases are declining. Some of our countries have relatively limited hospital capacity, and so we can quickly saturate our intensive care units, our hospitals with COVID patients. And really, believe me, you don't want to end up in a hospital with this disease, a hospital that is overcrowded, an ICU bed that is already being overwhelmed. So really my advice is to take all precautions. In my home country of Dominica, I urge all eligible people to seek out the COVID vaccine. There really is no reason to fear or to distrust these vaccines, as they can save your life, the lives of your family members and community. I want to urge the same for residents of all the countries of the Americas. Please get your vaccine when it is your turn and as soon as they are available. I also urge people to remain cautious about close interactions with others who may not be vaccinated or in closed, poorly ventilated places like some bars or restaurants. And please continue wearing masks properly and practicing the other public health measures that have been recommended by your governments. The pandemic is not over yet, and we must continue to be careful, at least until all those who are eligible are vaccinated. So this is my advice to countries in the Caribbean, but countries beyond the Caribbean and beyond the Americas. Okay.
Thank you very much, Dr. Tien. Those are good sort of closing words for our session today. Llegamos entonces al final de la sesión por hoy. Recuerden que pueden...
This is the end of our session today. Remember, you can find more information on the topic of COVID-19 and also the recording of today's session on our website, www.paho.org. You can, of course, send your questions, your follow-up questions through media team at paho.org. If you have any doubts or questions, you can send emails there. And thank you for joining us today, and we'll see you next week. Thank you very much.